so much for allowing us to come tonight and talk. My name is Blair Barker. I am the Care Services Director at the Camarillo Healthcare District. Has anybody come to any of our classes or screening services? Okay. So we are a special healthcare district. We were formed in November of 1969, and we were tasked with providing health and wellness services to Camarillo, Somis, and the Santa Rosa Valley area. And what is so wonderful about a special healthcare district is that people just think, oh, well, we have one here in Camarillo, we must have them everywhere. But we don't. We have about 78 in the state of California. We're structured similarly to a water district or a school district, where we are tasked with serving that particular community. So, lucky for you, Camarillo, Somis, Santa Rosa Valley Road. And we really work to maximize health and wellness services through evidence-based programming. So we focus on the social determinants of health, the things that happen outside of your doctor's office. And that includes nutrition, socialization, transportation, education, and supportive services. So one of our centers, sorry, I'm trying not to mess up your papers.
It's okay.
Okay. At the Camarillo Healthcare District, we have a Caregiver Center, and we were the first federally designated Family Caregiver Resource Center in Ventura County. We open doors to family members who are caring for a loved one with a chronic condition or a form of dementia that needed additional support about 12 years ago. And from the start of us opening the doors, there have been 2 other caregiver centers formed in Ventura County. One that covers East County called Senior Concerns, and then the Ventura County Area Agency on Aging has the other agency called La Buena Vida. And what we were hoping to do was to be able to be a supportive oasis for caregivers. If you've ever cared for a loved one, a friend, or a neighbor, you can understand how lonely it can feel. You can very much feel like you are floating in the middle of the ocean. And because we don't often talk about the trials of being a caregiver, we don't know what others are experiencing. But at the center, we have support groups, we have care consultations where you can meet with myself or one of my colleagues to talk about your unique caregiving situation. And we can connect you with resources we provide internally and then resources externally. We work very closely with a lot of partner agencies throughout the county because we understand that it is not a one-size-fits-all, that your caregiving journey is just as unique as you are, as is the person that you're caring for. And one of the things that we really have emphasized in the last year is our dementia specialty. Do any of you know someone who is currently living with dementia? Yeah, it can be, for lack of a better word, hard. It's hard for the person living with a form of dementia. It's hard for those who love them and who care for them. And so we have specially trained staff who are trained in ways to help improve communication, extend education on how to deal with behavioral issues. If your loved one tends to wander, we can talk about some strategies and brainstorm ways to help that. But one of the really important things to know that nobody talks about is if you're caring for somebody with a form of dementia and they wander, the first place to start is whatever side dominant they are. So if they're right side dominant, start looking towards the right, because just automatically they'll want to start walking that way. But there are a lot of other things that we provide in there. We have legal services where we have lawyers who work in the community and they provide their time for free once a week on Monday afternoon. We have a financial advisor who comes on the 3rd Monday of every provides his time for free as well. We have nutrition counseling, caregiver well-being and depression screening. We have dental screening, and we're looking at bringing others back. So if you know of a health professional who's looking at, expanding who they see, we'd love to work with them. In the past, we've had hearing screening, vision screening, balance screening, but we do have this really cool new piece of technology called the Her Senso Balance Machine. And it kind of looks like this large base that reminds me of, I don't know if anybody's familiar with the Dance Dance Revolution game. It looks like that, but it doesn't have all the colors on the base, and it has this cool screen, and you stand on it, and it looks like you're playing games. But really what it's doing is it's testing your balance, and it's testing your cognitive reaction, so your response. Because those two things work together. And from there, once we get a baseline, we can set up a game plan, for lack of a better word, to work with you over a set of weeks. We go through sessions where we cover different kinds of games that work on improving balance and response time. We know that falls are a major worry. I can share that I had a fall a couple months ago, and they stink. They change your life sometimes. And so we always want to think of different and innovative ways to be able to reduce that. Because when you have a fall, sometimes you can experience what's called the fear of falling. But we have a class called A Matter of Balance. And in that class, we do go through some light exercises, but we also go through other techniques to help reduce the actual occurrences of falls and reduce the fear of falling, because we know that the two go hand in hand. And when we have the fear of falling, we don't even realize that our hands go out. But also, we don't realize that sometimes it can make our world get a lot smaller. That fear can be quite large, especially if we have something big that happens, like a broken bone. And when we bring more into our world and make it smaller, we think, well, I know my environment, I'm okay. But most of our falls happen in our own home. So in that class as well, we also talk about home safety. We do a home, we ask our participants to go home with a checklist and look at their home with a new set of eyes, and we talk about strategies to make the environment a little safer. And then we also teach, if all else fails, let's show you a good way to get up if you have a fall. We don't ever want to do this to someone, because the occurrence of gravity bringing us on top of them is really high. And so we go through techniques and opportunities on how to teach that. And some other classes that we offer that coincide with fall prevention, we have a Tai Chi for arthritis. You don't have to have arthritis to take the class, but because it's for those who live with a form of dementia, who may have some aches and pains, it is a slower class. We like to call it meditation and movement. We have a class called Bingo Size, and it mixes bingo with exercise. It's a lot of fun. It's a newer class for us. And we also have classes around managing your chronic pain, managing diabetes, learning to live well with any chronic condition. We have a walking group. We have a really fun class called the UCLA Memory Training, and that's just for any of those typical, why did I walk into this room? Where did I put my glasses? I could have sworn I put my keys right here. If you've ever walked around a parking lot going, I thought I parked right here. This class will help that. Oftentimes we do so much on autopilot. We are thinking about the thing that we're going to do next. But we go through some techniques and some strategies to help combat that. Because our brain is really like a radio. You really can only get one station clearly at a time. So that whole idea of multitasking is a myth. because you're never fully giving 100% of your attention to one task. And that's often why we go, where's the remote? Well, what were you doing when you had it in your hand? Something else, right? We also have other programs. We have a senior nutrition program that has 2 arms, our in-person hot lunch, which is called our congregate. Outside of COVID, it meets the 3rd Thursday of every month. During COVID, we haven't been able to have it. And that's really been sad and disappointing because it's such a great way for people to come together. Over a hot lunch, we play bingo, we have drawings and things like that. And we hope, as hopefully the numbers go down, we can come back to that again. But we also do our home delivered meal program. And prior to the start of COVID, we were serving about 2,500 meals a month to around 115 older adults. At the peak of COVID, we were serving over 8,000 meals a month to over 400 older adults in the area. Currently, at the end of June, which is the end of the fiscal year, we served just shy of 350 older adults and just shy of 50,000 meals. We did actually hit a major milestone in our program, which is we have served over 500,000 meals since inception. We started the program in April of 2005. So that was super exciting to be able to do that. Because we're tasked with such a special gift to be able to serve our community and to find all sorts of ways to be able to do that. Beyond that program, we have our Adult Day Center, which has a variety of schedule times that are available to loved ones, where a person could come 1 full day a week, 1 half day a week, every day, part of the day on some days. It's very customizable. We have a social model in our Adult Day Center, so it's not just, bye mom, leaving her in front of a television. There are games, activities, snacks, meals. It's pretty much like a one-on-one with staff. Very, very fun. They're always doing something fun in there. We all wish our office was in there with them. And then we have a Lifeline program, which is that button that you press if you have a fall. They have also come into the 21st century, so you don't have to press it. Let's say you have a fall and God forbid hit your head, you can't press it. They have options where it will contact emergency responders for you. So that's wonderful. Transportation. We have a couple vans that I'm sure you've seen throughout the city. It's a caravan, blue and white with our little heart logo. And we provide public fares. We also provide fares for our participants who are in our Adult Day. Great program. It's a telephonic wellness program. It's designed for anyone over the age of 60 who may be dealing with social isolation or depression, loneliness. Maybe they just got discharged from the hospital, or their family said, hey, move to Camarillo. I know you love Maine, but come move out here. And then they move out here and they go, I don't have any friends out here. It's hard to make friends now. And with this program, we can call clients once a week. We can call them every day, Monday through Friday. It can be a real quick check-in, or it can be a long conversation. It's completely guided by our clients' preferences. And we have trained staff who are quite caring and compassionate, who love to talk to our clients. So if you know anyone who maybe is your neighbor, anytime you go to get the paper, you end up talking to them for 25 minutes, that might be a really great referral to our program. A good portion of our services are provided at no cost. Transportation, Adult Day Center, there is a cost. The Lifeline unit, there is a cost. But we also have quite a bit of coupons for Lifeline as well. So we always try to find ways to do what we can to help